My name is Dr. Hebron Kelecha. I am an obstetrician and gynecologist. There is a steep learning curve that I think that we ask of our patients to manage their gestational diabetes. And if you think about it from the timeline of they got diagnosed at anywhere between 24 to 28 weeks to the time of delivery, it doesn't really leave that much time to learn something that you've never done before and manage it at that time. If you think about diabetes management outside of pregnancy, it's something that can take people who are diagnosed with it a long time to kind of get a good grasp on what to do and how they're doing it. So I recognize that when someone has this diagnosis, this is another ask of them to figure it out on top of what they're already navigating during their pregnancy. But I think when I think about this, we ask that patients, during this process, change their eating habits to one that's more balanced. We ask them to either increase or include exercise while the time that they're pregnant. We ask them to attend more follow-up visits. And lastly, the large and hard task, which is learning the system of how do I do these finger pricks and how do I actually monitor my blood sugars several times a day. We also ask it to be that it's aligned with your meals. And so those without access to glucose monitoring that's also electronically recorded are also then asked to take that blood sugar and then write it down on a piece of paper, which I can't even imagine sometimes keeping log of that one paper with you everywhere is also hard to do. And I think it can also be made much, much more difficult for patients who have barriers to access to care at baseline for their pregnancy, even separate from this diagnosis of gestational diabetes.